Met me before, welcome. As I've told, I saw a few people come in. There is paper on the sides, there is pens, there is water. Don't worry about getting up in the middle of the talk. I'm not going to be offended. Do what you need to do. There are bathrooms out the hallway also if you have to use them. Thank you very much for coming. I know Monday night in the summer, especially with this heat, sometimes it's hard to get out. But I think that what you're going to learn tonight will change part of your life. At least it changed my life after I started doing this type of exercise and how it affected me. So this is the second of the wellness workshops that I'm doing. The first wellness workshop was on emotional stress. This one is on physical stress, exercise. And the third one in the series is on nutrition. So this is the first part, and yes, it says eat like an elephant. It should say eat like an elephant. I've looked at this 50 times and I have not seen the typo. So eat like an elephant, look like a gazelle. But this is part one of that series. All three are important because if our health problems are created by physical, chemical, and emotional stress, then the solutions have to be physical, chemical, and emotional stress. Now, some of you have been with me for a few months. Some of you have been literally with me for many years. You will understand that we're also going to talk a little bit about the nervous system and about the communication between the brain and the body. Because nothing we do will work if our brain is not communicating well. And we're going to go through that a little bit, and then we're going to get right into the heart of the talk, which is on reverse training. So, let me get my clicker. So the objectives for tonight really are, first, to effectively educate you on how our brains communicate with our body. Why is that important? Why is that part of everything that I do and everything I talk about? Second is to introduce you to a revolutionary type of exercise that there is so much research being done on now. I find it very exciting because it's helped me in many, many ways. And then thirdly, for you to share this with your family and friends and potentially change their life as well. This information and the way our bodies work is fascinating, and I hope you get a lot out of it. So I always start with reminding us about physical, chemical, and emotional stress. They all affect our nervous system. They force our nervous system to adapt. And the wear and tear that all three of these stressors put on our body determines how healthy that we are. The difference between these stressors, physical, chemical, and emotional stress on our body, is nothing. They all affect us in exactly the same way. The food we eat, the anxiety we have, or the sitting at our desk like this all day, it forces our brain to adapt. And as our brain tries to adapt to all of these stressors, it causes the body to break down. So it really doesn't matter, physical, chemical, or emotional. The way our body adapts to these stressors determines how healthy we are. Now, what does stress have to do with our health, or what does exercise or the wear and tear that we put on our body have to do with our health? Health is not the absence of symptoms. Health is optimal function. Okay, how many of you here have either back pain, shin splints, knee pain, hip pain? Okay, isn't that why most of us are here? Because we've got some of these. The wear and tear we've put on our legs, on our body from the exercise that we do, the wear and tear started 10, 15, 20, in some cases 30, 40, 50 years ago. The pain may have started last month. So every day I get people coming into my office saying, I have no idea what I did. I turned the wrong way and my knee gave out on me or my back gave out on me. I don't know what I just did. Well, you didn't just do anything. Okay? You ever hear of the analogy, the straw that broke the camel's back? It just happens because it's a wear and tear thing, and eventually it gives out on you. So we're not here because of one day of exercise that went wrong or one day of exercise that we didn't get results. It's a wear and tear effect. Okay. For those of you that have been with me for a long time, I'm going to go through this fairly quickly, but I think we could all use the reinforcement of it. If we look up into the head, our brain is there. Do I have my pointer somewhere?
Yeah, I'm looking for
Right
it.
here.
Oh.
Oh, wonderful. Oh, I saved the seat for my pointer. Wonderful. Okay. So the brain sits here. It sends a power down the spinal cord. It sends messages through all of the nerves to every part of the body. So for your heart to beat, your lungs to breathe, your intestines to digest, for everything in your nervous system to be functioning properly, these messages have to get there without any interference. Okay, but sometimes there's a blockage right in through here or right in through here. Maybe you've sat like this all day, or you've exercised and you've jogged and you've put a lot of wear and tear here, or perhaps you sleep with your arm like this and you're twisted all day. Okay, so some of us get these blockage points. And when we have damage here, where else can there be damage? The heart, the lungs, the kidneys. That's why so many people who have posture like this, or they do these sitting at their desk all day, that's why so many of these people have heart problems and lung problems. Now, I'm not saying every person that sits at their desk all day or has poor posture is going to have a heart attack, but it's part of the puzzle. Okay? In our office, the first thing that we do as a new patient when you come in is something called a thermal scan. The thermal scans are completely non-invasive, and what they do is they measure the amount of stress in your nervous system. It's not diagnostic. In other words, if we see stress there, we're not saying, okay, your heart's damaged, your lung's damaged. What we're saying is there's a lot of metabolic activity there, and there's a lot of stress. If you see green stress, it's mild. If you see blue, it's moderate. If you see red and black, it's severe. We don't want to see any red and we don't want to see any black. It could be indicative of arthritis, bone spurring. It could be indicate that there's squeezing of the spinal cord, and that's what we're looking for. So what we've actually done is, some guys should be here any minute. I might ask Rob in a pinch. I do have the scan here. Okay? Any of the guests here tonight that have never had a scan, it takes maybe 2 minutes. We're only going to do your neck. It's completely non-invasive. We're only reading heat that comes out of your nervous system. So it'll be maybe 1 minute to 2 minutes that it takes, but you'll be able to see the amount of stress that you're currently under. And it's a really big eye-opener. So if some guy's not here, maybe in the next 2-3 minutes, Rob, maybe you want to do it. And then I'll indicate, maybe we'll start with the back row. Anybody that's never had a scan can just come up. It's pretty easy. The reason that this is so important is because I don't want you exercising a damaged spine. If you start to exercise and your knees are damaged, your hips are damaged, your back is damaged, everything that we teach you is going to be useless because you're just going to make it worse. Okay, I often talk about something called the hammer and the nail theory. If you have a hammer and it's bent, and you start to nail that bent-in nail, you start to hammer it in, what happens to the nail? Just keeps getting worse, right? Just keeps getting more and more bent. That's what's going to happen if you exercise and your body is damaged. So if you jog and it's causing you problems, it's probably not a good idea to keep jogging unless you fix the damage. Okay? Same thing goes with biking or stair class or anything that you do. Okay, posture. I always talk about posture because posture is the window to your spine. If you look like this and you're 71 years old, when did that start? Probably when you were a child, right? This is why I've checked my kids since literally the day they were born, and why we check kids in our office. When you start this type of pressure in the nervous system, it can start literally from the day that you're born. And then all of a sudden the kids have colic or ear infections or digestive disorders, and the next thing you know, you're growing up with headaches and back pain and so forth. And it's all preventable. So I don't want this for my kids, and I certainly don't want it for any of your kids. So that's why we check everybody. It doesn't mean that everybody needs care. It doesn't mean that all kids need adjusting. We just check everybody. And the reason we do is because we want to avoid these problems later in life. Okay, so normal, healthy posture. There's one of the guests in the audience that has never been in to see me. Do you want to come up so we can just look at your posture? Do you mind?
Oh, B.
Yeah. Yeah, sure. What's your name?
Charlotte.
Hi, Charlotte.
Hi.
Nice to meet you.
Hey.
Okay, just face the crowd for a minute. A normal, healthy posture is even ears, even shoulders. From the side, the ears should be directly over the shoulder, not forward. The most common postural problem in human beings is forward head carriage. Okay? So,
I'm purposely not doing
No,
straightening up.
don't
Just
do
what
anything.
What I normally do.
Can anybody see which finger is lower?
Your left.
My left, right?
Yeah.
Okay, the head has a tilt to it, a natural tilt. Now, if we go to the clavicles, okay? Now which one?
Left. Left.
Left. So she's low on the left here, she's low on the left here. Now, excuse me, I don't want this to tickle, but I think you're going to notice a difference. Can you see which finger is lower now?
The right.
You got it. Because what is the body doing? If you're high here, the body has to do this. Why? Your eyes always have to be on the horizon. You can't walk a straight line. You'd walk in a circle if you're tilted. Okay? So that's the reason the body does this. Okay? Now, I want you to look at the side. Perfect. Now, as I was saying, when you draw a straight line down, the ear should come to the middle of the shoulder. Can you see this comes to right at the very front of the shoulder?
Yeah.
Okay? Draw a straight line down. We're looking at about here. The head should be right here. This is called forward head posture. Okay? Now, do you have any foot problems that you know of?
Yeah.
Okay. I just want to see something. Come face the audience, but I want you to hold on like this.
Okay.
Okay, just for some balance. What I want you to do is take your left leg, bend it behind you, and then with your right knee, I just want you to see it bend for a minute. Okay, go up and down a few times. Okay, can everybody see the angle of her knee is going down and in? Okay, the knee is not staying over the big toe. The angle is down and in. Can you see that? Can you guys see this over here at all? The knee. Come on over here. I want people to see this. Face that way. Okay. Bend up. Either knee, doesn't really matter, and then bend as deep as you can. Can you see that angle that the knee is going down on? Okay, it starts down and it scoops inwards. Okay, have we seen that?
Yeah.
Okay, thank you.
Sure.
You can sit. Important, because that means that the feet are rolling inwards. Okay, it's called overpronation. We're not going to go through all the foot function tonight, but what this means is that when she puts weight on her foot, the foot is rolling in. Now, let's watch something. If your feet roll inwards, like this, the hips will roll forwards. If the hips roll forwards, they will push the pelvis forwards. Now, I'm exaggerating everything for the sake of this instruction, but it's doing this. Do you see where my shoulders go in relative to my pelvis? They go back. Where does my head have to go to balance? Forwards. There are a ton of people walking around with forward head carriage, and it's coming from their feet. So people come into my office with headaches, neck pain, and back pain, and one of the first things I do is look at their feet. Okay, they may not have any foot problems or knee problems or hip problems, but they have this. And in my office, we want to fix this. So if you're walking around every day and your feet are doing this to your head, and then we're trying to get it back, we're not going to have much success. Okay? Forward head posture is really, really important. Okay. So, knowing what you've now learned, that's not too good, right? You see how on here it's talking about the overpronated feet? Okay, the pelvic anterior translation that we just went through. Okay? Relative backwards of the shoulder, head goes forward. Everything that we just showed you. His health isn't too good. Okay. So when I started getting into the work that I do, one of the most important studies, a landmark study, was done. This was done in 2004. And what they did is they followed 1,400 people and they measured their posture. And what they found was if you had hyperkyphotic posture, you had higher mortality rates. What does that mean? You die earlier. This was in the Journal of the American Geriatric Society. Okay? This was a very reputable medical journal. Most medical doctors know about this information, they just don't know what to do with it. Okay? But that's how important this is. In fact, specifically it said you will die earlier from something called atherosclerosis. Arteries, heart disease, stroke, heart attacks. Okay? So again, you could have perfect posture and your cholesterol could be through the roof, your stress could be through the roof and still have heart problems. But if you look like this, your chance of having heart damage is greater. My dad was 53 years old and he was in perfect shape and he had a heart attack. Now thankfully he didn't die, but he's exactly what we're talking about. He had very poor posture, he jogged and he was exercising all the time. He had no symptoms, and yet at 53, we were rushing down to the hospital with him. So this really hits home for me. There's a lot of men and women who have heart attacks and have so many health problems due to the wear and tear that they put on their body. So it's really important that the exercise that we choose is more beneficial than negative. In other words, if you're doing exercise that is not getting you the results that you want, it's causing ankle pain, knee pain, and hip pain, wear and tear on your body, then the negatives are far outweighing the positives. Okay, exercise is not just about weight loss, it's about getting healthy. So if you can't get healthy and lose weight at the same time, then what are we doing? That is why I am so excited to be explaining some of this tonight to you about the burst training. Okay, I personally, the first time I started doing burst training, I lost 13 pounds in 3 weeks. I never felt better. My energy went through the roof, and I got excited about it. And what the recent research has been showing is that it is not only good for losing weight and increasing muscle mass, but it's also good for your heart. That's why it got me excited, and that's why I put this workshop together. So, say it with me. Burst training. That was lame. 1, 2, 3. Burst training. Thank you. I love burst training. But why haven't we done well in our exercises? What is our excuse? Everybody's got an excuse, right? Everybody thinks, well, this doesn't work for me. It's not going to be a problem with burst training. But let's be honest. How many people here do not have 45 minutes, 4 to 5 times a week, to do their exercise, right? We just don't. Yeah. Too busy. We have no time. I have knee problems. I can't do that. Oh, I'd love to get in shape, but my knees hurt, my back hurts. Okay? We all have an excuse. With burst training, what we're going to learn in just a couple of minutes, you won't have any of the excuses. The only reason this won't work for you is really if you don't do it. So, who in this room is motivated, willing to do this because you know it's going to work for you? Come on. I'm not showing you this unless everybody raises their hand. I'm sorry. It's Monday night, it's almost 8 o'clock. I want everybody in agreement. Okay, thank you. Okay, so when we're talking about the type of exercise and why we're combining this. Cardio aerobic response. First of all, it might be simple to people, but people get confused with aerobic exercise. What is aerobic exercise? Okay, jogging, riding a bike, swimming, Stairmaster. Okay, who has a different type of aerobic that they do? Anything a little bit more unique? Okay, swimming, dancing. Okay, if you're, anything that you're doing long periods is generally thought of as aerobic. But when we do this, there's a few negatives that come associated with it. It raises your stress hormones and endorphins. One of those stress hormones that it raises is cortisol. We all have cortisol. We need a little bit of cortisol. But you see, cortisol, when we're talking 10,000 years ago, was a stress hormone produced if you're getting chased by a bear, or if you are in the woods and you're hunting, or if you are starving and you need to survive, your body produces cortisol. So cortisol wants to preserve fat, and it stores fat. So when you're doing a lot of cardio, your body actually can want to store fat, which means you're not losing it. You're actually going to put some away. The little tire that everybody gets around and they've exercised for 20 years and they can never get rid of the tire, it's because of cortisol. But cortisol is also catabolic. Catabolic means it breaks down. So it breaks down muscle tissue, it breaks down protein. Okay? So cortisol is not a good thing when you have too much of it. And when we're doing a ton of cardio, we're increasing cortisol. But it also stimulates appetite. And it slows down your exercise recovery. Okay? So it's stimulating your appetite because of this catabolic nature of cortisol. So again, let's be honest. Who goes for a 45-minute run and comes home and you're so proud of yourself that you deserve a treat? So you go to the cupboard and you raid the cupboard and you have all your treats. Come on, I know I do it. I come home, I'm so proud of myself, and I have a box of Smarties because I just ran for an hour. Right? It stimulates your appetite. So we're working against ourselves. It decreases testosterone. Now we need a little bit of testosterone. Okay, so for the ladies in the group, I'm not saying you want enough testosterone so that you start being a man. It's not what we're talking about here. We don't want you to take on manly characteristics, but we do need a little bit of testosterone because it helps to break down fat. And the normal type of cardio also decreases your immune system post-exercise. So in other words, how many of you have gone for a big run and maybe been sick in the next day or two? You get colds, infections. It's very easy to get sick if you've been exercising a lot. Hi, Sangai. Will you do the scan? Thank you. Everybody, this is Sangai. Hi, Sangai. Okay, so it's all set up. Anybody in the back row that has not had a scan before, don't be shy. Come on up. Somebody can maybe grab the seat beside you. And you can just sit there. And then if you just go row by row by row, it's very simple, but it's an eye-opener for you. You can see how much stress is going. Okay? Don't be shy. Go for it. Okay. But cardio does have some positive benefits. Okay? It lowers your resting heart rate and increases your stroke volume. As long as you're not damaging your spine too much, it is good for your heart. It does increase the amount of volume of blood that your heart can pump out. It increases the good cholesterol in your body. It lowers your blood pressure. It increases circulation to the brain. And it does stimulate your lymphatic system, which aids in detoxification. These are all good things. So, how do we get the good things without the bad? Okay, marathon runners and sprinters. I want you to imagine that we've got a marathon runner and a sprinter right in front of us. Okay? Now, imagine that they both take off their shirts. Now, we're going to ignore the sprinter for a minute. We're looking at the marathon runner. What do you see?
Very slim.
Very slim. They don't have a lot of lean muscle. In other words, they're slim, but can you picture they even still sometimes have those little love handles at the bottom. They're really skinny. Picture all the marathon runners you see in the Olympics. Okay, some of them are tall and lanky. Now, some of you might find that attractive. It just is not generally the type of body figure that most people are looking for. Okay, they don't have a lot of lean muscle mass. They are very thin generally. Okay, now let's picture the sprinter. What do you see?
Ripped.
Ripped, exactly. They are ripped, they have lean muscle mass. Okay? Now, especially for the women, I don't want you to get the idea that we want you to be huge. It's about lean muscle mass. That's what we want on our body. We don't want a lot of the extra fat. We want to be lean. So that's what this is all about. The way that I'm going to show you to train the technique is more like the sprinter. What you're currently thinking of as cardio is more like the marathon runner. Okay, so I'm not telling you never to jog or never to do any of these activities. I was actually just speaking with one of my patients before I came down here. If you're doing these activities because you love them, They aren't causing you pain. It's part of your lifestyle, it's social, it's meditative. I'm not saying don't do it ever. But if you're doing these type of things as your means to exercise, as your means to get your daily workouts in, then once you learn this, I don't think that you're going to go back. This is from the Toronto Star. And as I said, all the recent research, this is in the last month. So I just took it out. You can see they're going through some very simple calisthenics, but they talked about high intensity in this article. And what the researchers came to the conclusion is that they believe it's an efficient way to get aerobic and strength training in one. It's all about getting your heart rate up. Burst training is exercising at 90 to 100% of your max effort for 20 to 60 seconds. So what it's doing is burning your body's stored glycogen. And then the body wants to replace that vital storage, so it burns fat over the next 36 to 48 hours. Okay, so what does that mean? It means you exercise today, and for the next 36 to 48 hours, your body is burning fat, you're losing weight. Isn't that incredible? You don't feel it now, you feel it later. How? Because over those 48 hours, you have been burnt, during the exercise, you've burned your glycogen stores, sugars. But the body wants to replenish those. So the only way to replenish those is by using fat. So it breaks down fat over the next 48 hours. And as it's breaking down fat, like when I do it, you get that burn when you, like if I'm doing abs with, as I'll show you, you might do abs with burst training. You do feel it a little bit while you're doing it, of course. But the next day, and then even the following day, you feel like you've just been working out again. Because it's burning the fat over the next 24, 36, and 48 hours. So that's why you can only do it every other day. Because you're working against yourself. When people are eager and they say, 9 minutes, I can do it every day. No, you can't. You're working against your body. You have to listen to what your body needs. And that's why we're discussing this, because it's all about using your hormones properly. You can't overdo it, you can't underdo it, but if you do it properly, you're going to get amazing results. Okay, so what these researchers found, and they did this on rats, was that when the rats did normal exercise, normal cardio, they lost no weight. But when they did sprints or high-intensity exercise, they would lose weight. Now, I have no idea how they got the rats to do sprinting. But they lost fat. Okay? This is why when you have a normal routine of doing push-ups or sit-ups, you don't get the results you're looking for most of the time because you're not getting your heart rate up. You're more counting to 50 or 100. You're looking at getting your reps in rather than getting your heart rate up and doing it at a max intensity. When you do it at a max intensity, I'm going to show you the protocol in just a second, you can only do it for so long. But if you're doing it properly, it's enough. Okay, fat expenditure. There is a greater increase in fat expenditure after high-intensity exercise due to growth hormone. That's the key to this. Growth hormone is released in direct proportion to how intense your workout is. Growth hormone helps to break down fat and to build muscle. There's also a positive relationship between carbohydrate expenditure, the breakdown of the glycogen stores, during exercise, and fat expenditure during recovery. It's exactly what we just talked about. You're burning the glycogen stores during the exercise, so your body has to replenish them by burning fat afterwards. Just another study that they did, what they found is that the group that exercised at 80 to 90% of maximum heart rate, they lost a lot of fat. The people who did it at 60, 70%, which is normal exercise, they didn't lose anything. Okay, with burst training, there's two aspects to it. So I want you to be very clear on this. We're going to start going through the specifics of it now. Okay? There's two things you can do with burst training. You can do general weight loss, general cardio, general health. With that, you're going to use the biggest muscle groups in your body and do a general exercise, which we're going to talk about in just a minute. The second option that you can do is specific muscle groups. Strength training, abs, biceps, legs, tricep, the normal weight training that we're talking about. So if you want to do some type of exercise every day, you can do the general one day, the specific body part the next, the general, then the specific, the general, then the specific, so that you are doing your 9 minutes every day, but you can't be doing the same thing. The general has to be every other day, and then the specific body parts can be every other day. Because when you're doing burst training and you're doing it for resistance and strength training, it does increase the metabolism in the lean muscle. It raises the growth hormone and the testosterone, as we've talked about. And the growth hormone and the testosterone is essential for fat mobilization. In other words, both of those things, when you ask why, Noman, it's because of growth hormone and testosterone release that you're breaking down fat so that you can replenish the glycogen stores. It's all an evolutionary process that our body goes through to try and replenish those stores that our body wants. Okay, so when do we do burst training? I know what the slide says, but my general rule is, I'm happy if you do it. But if you want the best results, do it right when you get up. The first, get up in the morning, brush your teeth, whatever you do, spend 9 minutes before you do anything. The results are that much better. A, it's the best compliance. You've got it done, it's done for the day. B, it raises your growth hormone the most right in the morning. C, that's when your testosterone is at its highest, so you're going to stimulate the fat burning process the most. Insulin is at its lowest, so insulin is not uptaking your carbs, your sugars, and it turns on your metabolism the most. So if you're going to get the best results, do it right in the morning. But if I'm honest with you, I do it in the morning, I do it between patients, I do it at lunch. I'll do it whenever I can because I want to do it and I want to make sure I keep to the protocol. But if I can, I'd rather do it in the morning. It's all about your hormones. As I was saying, we can't cheat the body. You can't do it too much. You can't do it too little. If you do it exactly the way you're supposed to, you're going to get good results. Okay. This is the main chart. This is as simple as it gets. There's 4 different ways of doing burst that I have found to be the most successful. If you only do the first 2, don't be disappointed. The last 2 are extremely hard. I can't do the last 2. I don't know many people that really can to do it optimally. So let's go through it. And then I might have, if someone's brave enough, to come up and try this. 20-second spike and recover. What that means is you're going to do a general. The first one is for general, the biggest body parts. You're going to do a 20-second as hard as you can. Then you're going to rest for 20 seconds. Okay, who here has an iPhone or a stopwatch or something? We all have got some type of PDA, right? Okay? You have to have something with you because I don't want you counting. If it's 21 seconds, 22 seconds, that's okay. But you shouldn't be counting in your head. Okay? Have something to watch. It's 20 seconds on, 20 seconds off, 20 seconds on, 20 seconds off, 20 seconds on. So what is that? That's 60 seconds of exercise with 2 20-second breaks, right? Then you're going to take a 2-minute break. Then you're going to do that again. Then you're going to take a 2-minute break. And then you're going to do that again. If you do the math, this comes to 9 minutes. Exactly. Okay? So let's go through it a little slower so that you understand a little bit what I'm talking about. The easiest form of this is if you have a treadmill in your house and you can literally put it on and sprint for 20 seconds. But we don't all have the luxury of that, nor do we all want to do the sprinting. Remember, this is all about engaging the biggest muscles of your body. So, who remembers doing jumping jacks in grade 5? Okay? Jumping jacks works just great. Okay? No problem. Does anybody remember a burpee? Okay, I'm going to demonstrate a burpee. If you guys have not seen it, it works. Down, out, up, down. Okay? Down, out, up. A burpee. Now, some of you are already shaking your heads going, I'm not doing any of that. Okay? Skipping. Skipping is awesome. Okay? And again, those of you with bad knees are again looking at me saying, I'm not doing that. I've got your number. Fake skipping. I do this all the time in my office. So if you're waiting for me to come get an adjustment and you hear the ground pounding, this is what it is. As fast as you can. Or whatever it is to get your heart rate up. Okay? Or running on the spot. I had an 82-year-old woman who wanted to do burst. She had arthritic knees. She did fake skipping without ever leaving the ground. She's using her legs, she's using her upper body, she's using her arms. Okay? You can be creative. Anybody here that wants to do this, we will figure it out. At your next appointment or in the next few weeks, book some time with me. We'll just sit down and we'll say, what can you do? Okay? Does anybody have access to a pool? For those of you who have bad knees, bad ankles, bad hips, a pool is wonderful. You don't have to swim, but you can sprint in a pool in the shallow end. It's not going to be hard on your knees. It's anti-gravity. It's not going to hurt you. But you can sprint in there. You can do squats in a pool. You can just jump on the spot in a pool. It is so good because it doesn't hurt your ankles, knees, hips, or back.
How do you get the burst effect?
You're going at as hard as you can. As long as you're going as hard as you can, this works. That's why it's good. It's about as hard as you can. The 82-year-old woman that I did, she got her heart rate up. And believe me, she wasn't leaving the ground. Okay, she was just doing this, but it was hard for her. Her heart rate got up, she engaged the hormonal system, and so she got really good results from it. It's all about figuring out what motion can involve the most muscle mass, the most parts of the body. Does anybody have any questions about this?
The older you are, the less growth hormones your body would produce, right? And the same
Yes.
for testosterone.
Yes.
So it would be less effective if you were older?
Well, yes and no. Your body also, we're very adaptable, okay? I do not expect if you're 82 years old that you're going to lose 40 pounds in 2 months. No. But remember, we're looking at a few different things here. What are your goals and what are your objectives? Is it a weight loss thing? Is it just being able to exercise? Is it gaining more energy? Okay? At 82, I was concerned with energy level, heart function, mobility. As her energy increased, she was more active. As she was more active, she was more mobile. She had more muscle mass. Positive, positive, positive. Right? So our goals change depending upon our situation. But the fact is all of you can look at what your goals are and be able to achieve that. Okay? Does anybody, I don't want to move on from this one because this is the heart of it. I want you to fully understand it. I don't want anybody leaving here that could not go home and do this tomorrow, or at least after discussing with me what motion. Okay? 20 seconds on, 20 seconds off. 20 seconds on, 20 seconds off, 20 seconds on. That's it. Take a 2-minute break. Do it again. Take another 2-minute break and do it again. Okay? So if you do the math, you're doing in each set, you're doing 60 seconds of exercise, and you're only doing 3 sets. So in the 9 minutes, you're only doing 3 minutes of exercise. but you've gotten your heart rate up, you've stimulated your hormone system, you've got the growth hormone, the testosterone all being produced, you're working your heart. Okay, it's really quite amazing. It's only 3 minutes of exercise, but it's all in 9 minutes.
Do you have to give up your other exercise?
No. Again, it all depends upon what your goals are. I had someone today that was telling me, but it's a social thing. She likes to jog. Great, but if your jogging is killing you, stop, right? But if there's other things, like I play hockey, I do a whole bunch of other things. Exercise, I love exercise, but I don't have time, nor do I like the shin splints I get doing jogging and some of these other things. So this is all about getting you results, whether it's weight loss, heart function, you name it. Okay, are we clear on the first one? Okay? The second one is very similar. You'll see it's 20 seconds on, 20 seconds off, but it says 3 different exercises. You can actually do the same exercise or 3 different ones. But what we're talking about here is the more specific to the body part. When I started doing it, I did 3 different ones. The first one I did was for chest and upper body. So, simply into a nice, stable posture. Remember again, you want your spine in a good posture. You don't want to hurt yourself. And I did this as fast as I could for 20 seconds. Okay, now, again, we've got to be careful of technique. I don't want anybody blowing out an elbow. Okay? But it's all about engaging your arms. I mean, I could feel it all through the chest. Okay? I didn't love going to the gym and doing a lot of bench press. But this is very effective at exercising the same muscles. Okay? Getting lean muscle mass. So this covered that portion of it. The second, abs. Now, I like doing it on an exercise ball. You might not like to. But if you get, again, you want to have a good posture. So you want straight, and then it's just crunches. But instead of counting your crunches, it's all about time. So I'd have my iPhone beside me, and I'd just roughly do about 20 seconds. Do them as intense as you can. But again, it's all about technique. Okay, when you're doing abs, you don't want to, you're not yanking on your neck. So you want to relax everything but the abs. But there's 50 ways to do abs. And if you want to discuss different ways to do abs, we can do that. Because you can do it on the ground, you can do it on a ball, you can do abs standing, you can do it with your legs instead of your upper body. Depends on which part of your abs you want to target. Okay? You can do the same thing with back muscles. If you go over a ball and you do this type of thing, you can also do the back. But again, it's high intensity, it's as quick as you can, but staying controlled. Don't get out of control. And then the third one, and this is a hard one, I challenge anybody to do this for longer than 20 seconds. Does anybody know what mountain climbers are? Okay, mountain climbers are tough. Okay, the way I used to do them was this, and then you're basically just doing this as hard as you can. I'm not doing it now because if I did, I wouldn't be able to talk afterwards, and that wouldn't be very good for getting the rest of the information. But that's 3 different exercises. You could do abs, the whole one. You could do chest, the whole one. You can experiment with that, see what kind of results you get. The difference here, does anybody see the difference? 1 minute recovery. The reason being, when you're doing a more general one, you're using all the big muscles of your body. If you're going hard, it's going to take you close to 2 minutes to get your heart rate back down. If you're just doing a bicep or a chest or an ab, within a minute your heart rate should come down quicker. If you need to take a minute 20, it's okay. If you want to start up again after 50 seconds, that's okay. But you don't need as much time as when you're doing the sprints or the skipping or the jumping jacks or so forth. Make sense? Any questions about that before we move on?
On that one, would you do 3 rotations or 3 sets again? Or?
Exactly the same thing.
Okay.
3 sets. So this one, if you're doing this one properly, this one takes 7 minutes. Okay, so I do 9 minutes one day, 7 the next. 9 minutes, 7 minutes, 9 minutes, 7 minutes. So I'm doing at least 7 minutes of exercise a day, or 9. I just alternate. Okay? Now, if you want to go out and play hockey or go for a jog or go dancing or what have you for fun on the same days, have fun. We're talking specifically about getting the results just from burst training. Okay? Because you'll be engaging different systems by doing some of this other exercise. The only thing I would encourage you not to do on the same day is don't do burst twice in the same day. If your friend says, hey, come to the gym with me, let's do some high-intensity workout. No, you've already done it for the day. If you want to go for a jog, go for it.
So, Mark, the burst training, the first one that you're talking about, if you just did that one, and not of these,
That's it.
and you do it every other day.
Every other day. Yep. If everybody in this room only did this, you'll get great results. Or if these are your goals, if you only did this, you get good results. When we're talking here now at the 3rd level, you'll notice it's just more intense. A 30-second spike with a 30-second recovery rate, 3 different exercises, and you're only getting 30 seconds between those 3 sets. It's just more intense. But you see, if you're not of that caliber of athlete, your heart rate's not going to come down in the 30 seconds the way we want it to. You're not going to engage it properly. So could you force yourself to do this? You probably could. But you got to be honest with yourself. I mean, I've seen a few people who are, Olympic caliber athletes. They can do these ones because their heart and everything is trained to do it. I certainly don't. I don't put myself in here, and I don't know that I'll ever be, just because I don't do that kind of training. Okay. The last one, is really intense. It's a 60-second spike. You try to do any of these activities at maximum heart rate for 60 seconds. By the end of 20, it's tough, especially after the 2nd or 3rd set. So this is pretty intense, and you're doing 3 different exercises, and you're giving yourself 60 seconds between the sets. So, good luck, and I'd like to hear someone tell me they're doing it. That'd be great, but I'm not attaining to get, my goal is not to get there, but every now and then when I do talks and I speak to people about it, there are some really good athletes, and so I want them to know that this is a possibility and you will get great results by doing this, but I just don't know, the average person isn't going to get there. Okay, any questions?
Would you say going up the stairs would be something,
Well, yes and no. You can definitely do this sprinting up and down the stairs. The problem I have with that is I would bet 80% of the people in this room have some type of ankle, knee, or hip problem. And going up and down stairs is the worst. So if jogging is bad, going up and down stairs is even worse than that. So yes, you can certainly engage the process by doing it, but I would make sure I'd have your ankles, knees, and hips checked. I'd make sure you're wearing orthotics. And if it's a go, then great. I just don't want you in 20 seconds blowing out your knee.
How do you know that you're at the 80-90% level of your...
You go about as hard as you can go without blowing yourself out, and that's 80-90%. When I'm doing the abs, without having some biofeedback machines on you, something measuring your heart rate and all that kind of stuff, do it as hard as you can. And if you're doing it as hard as you can, you're there.
Can you do this?
Yeah, sorry.
For the first stage, an elliptical is good.
Elliptical is good, but and I don't mind them because they're smooth. The problem is depends on the setting you have. If you can go at it pretty good, you are using your arms, you are using your legs, I don't have a problem with it. If you got an elliptical at home and you can find a motion that's comfortable for you, go for it. Yeah.
You do it on an empty stomach.
It's the best. In the morning, that's the best. Again, I'm happy if you just do it, but yes, that would be the best.
Do we have to stretch our body before starting this exercise?
You're ahead of me. Drink a lot of water. Have some water with you while you're doing it. It's only 9 minutes, but even during the 20 seconds, take a sip. In the 2 minutes between, have some water. Warm up, definitely. The way I would suggest anybody warm up, you don't need a huge warm up. You know, bounce, get your blood flowing. Do a few jumping jacks. Just walk around, kind of get things moving. You know, it's not good to do anything cold. Definitely warm up a little bit. You don't need a huge warm up, but if you've just woken up, gotten out of bed, and you're sprinting, not the best idea. Yeah, well, exactly. And you know your problem with getting out of bed is part of your burst. You gotta, you know, but, yeah. And again, maintain normal posture. Don't do any motion, don't do anything that is going to cause things to get worse. Okay, so when I did this slide, it was all, one of the people I first worked with, his name was Jason. I just like to talk about myself because it becomes more personal. As I said before, I lost 13 pounds in 3 weeks, and when I do this, my energy level goes up. I feel great, and really it's much more effective than any other type of exercise I've done. So the keys to this is understanding the process. So first of all, what does your x-ray look like? If you're in the middle of correcting something, make sure we correct it. And then what controls your metabolism? What controls your hormones? Your nervous system. Okay, so like we talked about before, your brain sits here, it's sending messages down the spinal cord. Those messages exit the spinal cord and go to every part of your body. So for your heart to beat, your lungs to breathe, for everything to work properly, you need these messages pumping there. But as we talked about, if these little bones in the spine misalign, that's called a subluxation. And when you have a subluxation, not only does it damage the nerve, it damages wherever those nerves go to, leading to ill health, leading to disease. Okay? Our job is to prevent that. When I work with people, it's to make sure you get the best results from your body. We want to maintain the curvatures of the spine. And the upper part of the neck, as anybody in this room that's with me will know, is the most important part of the body. Because when you have a curve in the neck, there is a space inside of it that allows the brain to communicate with the body. Now let me give you a good example. About 6 months ago, I had a few people start care with me, and in the last 2 months I've had a couple of these people that have had the same type of results. They came to me with back pain, neck pain, headaches, in one case numbness and tingling and pain coming down the arm. So what we found after their x-rays is that their neck was subluxated. There was damage to the nervous system. There was pressure. So the brain wasn't communicating well. So we put them under care. After about 3 months, the pain was gone. That's great. But the protocol is to correct, not just to get rid of the pain. After 5 months, I started noticing they were getting thinner. And so when I spoke to him, he was in his mid-30s. When I spoke to him, I asked him what he was doing. And he said, well, he always has exercised. He's always been trying to diet, but he's always been about 20 pounds to 25 pounds overweight. The only difference that he had made in the last 3 to 5 months from his normal exercise protocol, from his normal diet, was fixing this. In other words, the communication channel was open. Okay, so why was he losing weight? Well, someone's got to know why he was losing weight. Why?
Because the brain was able to communicate to the rest
Because
of the
the
body.
brain was now communicating. Before, you can do everything else. There's so many people that get frustrated because they do yoga, they do tai chi, they do acupuncture, they go to massage. All of these things, and they don't get the results. They're on supplements, they go to naturopaths. Doesn't matter. I use all those things. I have colleagues who are those professions. I'm not against them. But the reason you don't get results is because if your brain is not communicating, you cannot get results. Okay? I want everybody in this room to have success with what we're talking about tonight. But you cannot have success with this if your brain is not communicating with your body. It's impossible. So I believe that everybody in here will have success. You all put up your hands at the beginning, even though you were forced to, meaning that you will get results because you are going to do this. But you do have to make sure that your brain is communicating. Because the only reason that that guy started losing weight then was because finally his body was starting to communicate. Okay. Your nervous system is the window to your health. So, in my office, there's two types of care. There's functional and there's corrective. Functional means if you come in like this, we might be able to help you with your pain, but you leave and you still look like this. It's functional. Over time, you're going to get worse. It doesn't matter, because if you look like this, eventually it just keeps going more forward. But we do a technique in our office. Those of you that have been with me for a long time know we did extra training. There aren't that many people in Canada that do it, although now there's a growing amount. But it's called chiropractic biophysics. And the reason our practice is so busy is because we're getting very good results with people, not only functionally, but getting them corrected. So if you look like this, we are bringing you back to here. Now, most people who don't know what their x-rays look like, back to here does not mean straight. Back to here means you have a curve. Your ear is over your shoulder, but there is a curve in your neck. Now, here's a test. See if anybody's been paying attention that's been with me for a while. What's the normal curve in your neck supposed to be?
42.
Thank you. 42 degrees. And the spinal cord goes right down behind here. There's a channel to go through. There's a channel that the spinal cord can go through when you have a curve. But as your body wears down, you go into a phase 1. It's straightening out and it's squeezing the spinal cord. Now, what are the two characteristics of a phase 1? I told you one of them, it's straight. What's the second characteristic?
Squeezing.
Forward. Straight and it's forward. Does anybody remember how long a phase 1 takes to develop?
10 years.
10 years, you got it. So from here to here, most people, it takes 10 years to develop. It can start right from a baby. Phase 2. In a phase 2, you are straight and you are forward, but what's the third thing? Bone spurs. Bone spurs, arthritis. The spinal cord is coming right down here, and the bone spurs are putting pressure on the spinal cord and literally crushing it. If you're in a phase 2, your nervous system is being damaged every day. Phase 2 takes how long? 20 years. Phase 1 and phase 2, we can bring back to as close as normal as possible for you, depending upon how severe it is. Okay? Phase 3, what's the characteristics of a phase 3? Fusion. The vertebrae are starting to fuse together. We can't fix it. A phase 3 takes 30 years to develop. These are the old men and women that start looking like this. You cannot have good health in a phase 3. We don't want anybody getting to a phase 3. I always feel a little sad when people show up in my office a bit in a phase 3. We can do functional care. We can help them stay as healthy as possible. But we can't correct it. Okay?
Mark,
Yeah.
what happens with babies who are delivered by forceps?
Well, that's why we check. My daughter wasn't forceps, but she was stuck on her mom's pelvic bone like this. Okay? She came out looking like Rocky. She had bruises under her eyes. Her nose was like this. And they had to pull and yank. And I swear, I mean, the doctors were not negligent. So this is not anti-medical. I saw what they did, and they had to do what they did. But when my daughter was delivered, they put her on a table, and I said, I just want to check her spine, because C1 is the most important part of your nervous system. C1 is right up at the top. Okay? There's a little point here called the dens. If the dens gets fractured, it goes right into the spinal cord. Does anybody hear of, when you have a hangman's fracture, people hang themselves? It's because they crack their dens and it goes right into the spinal cord and you can have instant death. So if you are at birth pulled and you have birth trauma like that, you can damage the nervous system right at square one, and that's why all these problems happen later. So I told the doctor I was going to adjust my child, literally on the table they were born on, and the nurse and the doctor both looked at me like I was about to kill my child. And they watched, they looked around at me, and I took my pinkies, and I went right in behind her ear, and maybe about an ounce of force. I mean, it was just, boop. It was shifted to the left, I shifted it back to the middle, and they all looked around and, oh. I said, what did you think I was going to do? I just watched as you yanked literally her head out, and I'm going to come in and like, what did you think I was going to do? So after they saw me do it, they all kind of went, okay, now they're relieved. Thanks, they're relieved. I just watched my daughter, she looks like Rocky, but I love treating babies. Some of you may have seen young babies in the clinic when you come in. Just 2 weeks ago, we had a baby with colic. The mother said this kid will not stop crying. They do not have the emotional baggage that we do. 3 adjustments, the baby stopped spitting up like they were, stopped crying like they did. The grandmother was there and just said, it's a different child already. 3 adjustments. So they respond much better than
So
the
you're
adults.
saying the neck needed to be adjusted for the baby?
C1, the very upper vertebra, was shifting to the left or the right. It pulls at the spinal cord. And if it does, it affects a lot. Also, colic is between here. If you ever seen parents, they take the legs and they bring up the baby and they can kind of do this to the neck. If you jam the vertebra between the shoulder blades, then it can affect the digestive function. Okay, babies are really easy to work with. You just have to use your fingertips, very gentle. But it's the same as adults. If there's pressure on the spine, pressure on the nervous system, it affects what we do. Okay, so as we're saying, is subluxation reversible? Absolutely. You just have to know what you look like, as long as you're not in a phase 3. So having your spine checked is important. But the main thing I want you to understand is no matter where you are, with your exercise program, with your diet, with your emotional state, start where you are. People have to just start. Then you'll get better. Okay, start with where you're at. Don't judge yourself. Just start. Everybody has to get checked for nerve interference. It amazes me that the average 5-year-old knows to go and get their teeth checked. Okay, my kids now are 5 and 8. If they get sick, if they have a cold, if they fall, they just come and ask me to check them. It's just normal. It's not weird, it's just normal. Let me get checked. What are we doing all day? We're doing this all day. We're sitting in chairs. We're never meant to sit in chairs. What other intelligent species on this planet sits in a 90-degree posture? Animals sit on their haunches. They're smarter. They keep their spine in a good angle. Or they lie down. Okay? We weren't meant to be on cement floors, on cement tiles. Okay, they talk to you about wearing these shoes that are like bare feet, and you're supposed to have these new shoes. Well, the fact is when we wore bare feet, we climbed trees and we climbed rocks. If you try to mimic that now and wear those on cement, it's not going to work. Okay, we have to get checked because our bodies weren't really meant for the things that we put on it. Okay, 1,000 years ago, the hormonal response that produced anxiety was necessary because you were being chased by a bear. You needed to release adrenaline so you could run away from it. Now our boss yells at us and we get the same response. Okay, so we're dealing with things now that we never were supposed to. All we have to do is keep our nervous systems functioning and get them checked. Okay? Tonight's talk, as I said, was the second. I will be doing the first one again. The next one is on nutrition. Okay? My partner in crime, my colleague Aviva Kamlos, she's going to be doing some of the nutrition lecture with us because she's a holistic nutritionist. She keeps me healthy with what I eat. I'm sure most of you have seen me eating my almond butter and my apples and my hummus and all day, okay? Because you're not supposed to be starving, you're supposed to eat all day. But we're going to be doing that. I want to know, just from a show of hands, because we've done the emotional, now we're doing the physical tonight. So the third one is on nutrition. Who in here would be interested in seeing nutrition, just so I have an idea? Okay, so a fair bunch of you. This is not scientific or anything, but I just want to get a clue. Would it be better for everybody, who would be available in August? and who would be available in September? You know, I'm just wondering, August? Okay, September? Sort of equal, okay. There are some flyers we have here. We may change the date. So what I'm going to do in a minute is I'm going to send around a sign-up sheet, just so that we have an idea of numbers. We have to rent this room. So you can write down your name if you can think of anybody that would like to come and see the talk on nutrition. It's also going to be a very good one. I'd like you to write down how many guests, just so that we have an idea of names. Now I want to close on a kind of final thought. The reason I'm doing a physical, chemical, and emotional workshop is because all three are important. If you are stressed out emotionally, your body produces cortisol. Cortisol will increase the fat that you're trying to get rid of with your exercise. So yes, you will get results with burst training, but if you're anxious and stressed out, it's going to work against you. Likewise, if you're not eating properly, there's no way any of this is going to work for you. All three are important. Okay? So when we're putting together a health plan, try to think about incorporating some of the emotional, some of the physical, some of the chemical. They're all important. Now, I see it's actually a good mix tonight of some guests and some current people that are with me. What I do is, generally when I do talks, any of the guests, usually people want to get themselves checked. So I like to make things a bit of a win-win for everybody. Usually to come and see me, at least to get a checkup, it's usually $100 for a complete exam, x-rays, the analysis, the follow-up. That's usually $100. So what I wanted to do tonight was create really a win-win situation. What I want to do is I want to charge $20. That $20 will not only include you, it will include your entire family or anybody that you care about. The purpose of my office is to reach as many people as possible. I'm passionate about what we do, and I really like for you to help me help others, because then we all win in the end. So, for any of my current people, the deal will still be good for you. If you have people that have not been checked yet, all they have to do is phone in the next week to book their appointment. I've told Sungai to open up as many appointments as it takes to have all of your friends and family checked. So for one group, it's $20 for everybody. And, as long as it's okay with you, I'm going to donate that $20 to the Starlight Children's Foundation, so that none of it is going into my clinic. I like to make a win-win out of it and help some kids out in the process. Does that sound fair to everybody?
Yeah.
Okay.
Are you
Yeah.
saying $20 for each person or 20 for the whole group?
$20 if for anybody in your friends or family that you want. It's $20 for everybody. Okay, as long as one person pays that $20.
Inclusive of everybody.
Inclusive of everybody in your family and friends. If you don't know everybody, if you tell Sungai approximately 3 people, 4 people, and then they phone and mention your name, I just want to make sure that she puts aside some time over the next few weeks and that everybody's covered that wants to be covered. Okay? And then as long as one person in that group pays the $20, I'm going to donate that to Starlight on your behalf. And anybody that actually wants the tax donation for that $20, we can arrange that too. That's fine. I either do it on behalf of my clinic or I can do it on behalf of you. So Sungai is here. Please tell her as many people as you'd like to get checked. Other than that, we do have some flyers as well here for the next talk. We will confirm the dates with you. And for anybody interested, this is a CD I did a couple years ago. It's only audio. It's all on stress. You might enjoy it. It's here. There's no fee for it. It's just I like to give them out. So thank you very much for coming. I appreciate it. And I hope you guys